Dr. Jaffe, what are the most effective natural blood thinners?
Well, first of all, why would you take a blood thinner? You would probably take a blood thinner because you would either had something inserted into you, or you had had certain valve surgery or certain joint surgery that requires platelets to not get too sticky and blood to remain thin, not too thin, not too thick. At this point, the natural and most effective blood thinner is to optimize your omega-3 and minimize your omega-6. Do not take any ultra-processed foods, and I recommend that in addition to being sugar-free, you be edible oil-free. We can talk more about that, but omega-3s are essential, and EPA, DHA are the active omega-3s. Yes, there's a precursor, but the people that need the omega-3 very often have enough heavy metals or other inhibitors that they can't convert the precursor into EPA, DHA. Then a very different molecule that promotes repair and therefore reduces inflammation and improves endothelial cell function inside blood vessels is quercetin dihydrate. And we have been fans of quercetin dihydrate and soluble OPC since the late 80s. We have added pomegranate juice evaporated for ellagic acid in one formula, but we have several different polyphenolic formulas like Pain Guard and Repair Guard that work synergistically with potent C Guard. Vitamin C helps everything. So nature's ascorbate, based on your C cleanse or however you decide to take it, will help keep the redox low and the cells flowing, will help keep the platelets from sticking, and help keep the blood clotting factors poised, because if your blood vessels are damaged or you cut yourself or you bruise yourself, you would want to be able to clot to prevent blood loss. So there are natural blood thinners, but what I suggest is that you take, for many, many good reasons, our PERC EPA DHA Guard, and our PERC Repair Guard or Pain Guard, and our PERC Potency Guard, at least. Probably along with Lifeguard to keep your urine sunshine yellow and the many, many factors that are necessary available. You can absolutely improve the efficiency of blood clotting. You might even call that a natural way to prevent blood clotting. But my mom needed open heart surgery and an aortic valve replaced, and she was put on Coumadin, warfarin, a blood thinner. My mom called me up and said, I understand that Dr. Jaffe, now, anytime the conversation starts with, I understand Dr. Jaffe, you have to keep listening. My mom says, how do I get off of Coumadin? I said, Mom, you adjust the dose of Coumadin. You don't get off Coumadin. You don't stop an anticoagulation therapy prescribed by a doctor casually. You can reduce the need for it by following our guidance, and I recommend, for lots of health benefit reasons, that you do. So you should be your own doctor up to the point where you need more guidance and help, and when it comes to blood clotting and platelet function and all that's involved with the inflammatory repair mechanisms, etc., you want someone who is a knowledgeable health coach or functional, comprehensive, integrative physician to guide this therapy. Because after a month or two on omega-3s and polyphenolics, you should check, because you probably will need less of the blood thinner. So very important question, and I hope this was a clear, supportive, natural approach to improving blood clotting and function. But be careful about being your own doctor too much of the time. A doctor who takes care of himself might have a fool for a patient. So follow this guidance, and many things will get better, but especially blood thinning, blood clotting.